second Fraser Health Authority public board meeting virtually. We've been spending a lot of time virtually, I'm sure most of you, in the last year, and we thought we should try and make this work for ourselves and a way to connect with people in the community. So thank you for joining us tonight. We really appreciate that. I want to acknowledge, first of all, that Fraser Health provides services within the ancestral and traditional and unceded territorial lands of the Coast Salish and the Nkalhapa nations. And we respectfully provide those services here and thank them for allowing us to do that. I want to thank you for showing up tonight, but also to thank you for your continued support for our work as a health board and for your work in the community and for all of the work that we've done collectively to get through this last 14 months. I don't think any of us could have imagined 14 months ago what would have happened in the last 14 months or where we would be today. And I do know this, that the board has been there and the leadership and the people who work in the system are there every inch of the way, and we'll be there to the end. We will see the end of this disease, and we'll see that together, just as we started it. I do want to acknowledge the number of people who have died in our region and this province as a result of this disease. Our feelings go out to those people and to their families. This has been a very trying time for all of us, but in particular for people who have lost loved ones. And I want you to know that as we speak here tonight, our hospitals are full of people working 24 hours a day to try to make sure that that list doesn't get any bigger. And they're doing that as they have every other day of their lives, but particularly in the last 14 months. I do want to say that we have a number of questions. We hope to get to all of them tonight that have come, and a number of really good questions. I think if you're tuned in, I'm looking forward to learning a few things tonight as well from the answerings of these questions from different people, and I hope that you have the same experience. Let me take a second just to talk about our work. The healthcare system has never been more challenged than it has in the last 14 months. And never have we seen the widespread illness that we've seen or the challenges to our system to make it not only good for people getting the healthcare, but safe. This disease spreads, as you know, from person to person. It's a difficult disease that way because our best friends could be our worst enemies when it comes to the disease. And that's one of the challenging things of this whole experience that we're having. But we have done an amazing job, I think, and I just want to take a moment to thank the staff on the front line. When you go into that hospital or you go into that facility or you go into the long-term care facility, you're greeted by people who are often working 12-hour shifts and have been doing it many for years and many for months and months. But they are the ones that have done the miracles. If it wasn't for them, our death rates would be through the roof. Our sickness rates would be higher and higher, and we would certainly be in a crisis. Having said that, tonight as we meet, our hospitals have never been fuller. It's important to understand what we're facing as we look forward in the next 3 to 4 weeks. Since April the 1st, we've had a 264% increase in the number of people in ICUs. That means ICUs are basically intensive care units, and if you're there, you're extremely sick. And so just to put that in perspective, we have 95 people in there, or over 100 now in those ICUs. And the largest number we had at the beginning in the spring and in the winter was 46. So as you can see, we've had to close down elective surgeries. We did not make that decision lightly. We kept it going as long as we could because those are important surgeries. Last time we closed it down in the spring immediately. And we were 15 or 18,000 behind of surgeries behind that we've been catching up and doing an excellent job doing that. But we've had to close them again, unfortunately. And that's because it's not about the bed space. We need the people. Healthcare is about people, and we need those nurses and those doctors and their support workers to be able to do the work that we're doing. I want to say something about some of the other challenges. We have a large number of people in our region. We're the largest region, 1.8 million people. We have the largest number of cases and some of the highest infection rates. And it's not because somehow we're weird here or that we do things differently or we haven't done our job. It's because we live in a region that's like no other region. When people get up in the morning in the other regions and they buy their food and buy their products, get their services, they often get created and made in Fraser Health because it's here where the factories are. It's here where the food processing plants are. It's here where the manufacturing plants are. It's here where the farms are and the interior with farms. And it's here where the frontline workers live and work. And we all know that getting sick at work does happen. In the last 14 months, over 1,000 work sites have been infested with this disease. Many thousands of people have been sick. And in the last 3 weeks or 4 weeks in April, we saw that number rise to over 300 in 1 month. So we have taken action, like on many things. We've closed down 92 work sites in the province. 92 work sites in Fraser Health. And the reason we did that was to stop the spread. And it appears to be helping. But we will continue to do that. And we don't want to close places down. But frankly, we had to make some tough choices. And that's what we're making today to do that. So we are hopeful that we can stem the tide. I know we will, and move forward. And we're also, I want to say that one of the toughest jobs is contract tracing. Folks, when you get sick, you're not only we have to worry about, it's all the people you came in contact with. And hundreds of people every day phone thousands of people to find out who they've been with, who they've talked to. And I know many of you are in isolation as a result of that. And you may think that's punishment. It's not. It's not only for your own good, it's for the good of the people you love around you. And so I think that's one of our challenges and one of our success stories is we've gone from tracking 100 people last spring to tracking upwards of 600 people a day. And that's been a huge challenge for us to do that. So I want to just end by recognizing that our local community partners, many of them in different community groups and organizations, have been really special to us. And you've made a big difference. And your support for us has been a huge difference. And I know that all the healthcare workers feel supported and want to feel that support. And I know that if I make one last thing to say before we start the meeting, please sign up and get registered and get your vaccination. It is the solution. And if we all get vaccinated, then this will end. And if we don't, it won't. It's not complicated. It's quite simple, actually. And you can look at the success of long-term care homes to see why that works. So again, thank you very much. I'm just going to introduce the board members, the people that, and we've been meeting as a board two or three times a month to make sure that we are on top of what's going on and hopefully helping to support our staff. I'm the board chair. My name is Jim Sinclair. Indrajit Hundal is not able to be here tonight, but he's the governance and HR committee. Manpreet Gruel is the director. Oprit Kang is the chair of quality and performance committee. Jesse Lahal is the chair of the digital health committee. Willie Charlie is unfortunately unable to be here because of family matters. Ramya Hozak is a director. Tom Kim, the longest serving board member we have, is the chair of the finance and audit committee. Joan Mills is a director, and Nicole Aslan is a director. And now I just want to turn and introduce the executive. You can't see them all, but sitting there in front of you is Dr. Victoria Lee. She's the president and CEO of this organization. I'm sure when she took this job on 2 years ago, she never imagined what it was going to be, but she's done an amazing job. The other people I'd like to introduce are Linda Dempster. She's the VP of Patient Experience and Pandemic Response. Dr. Elizabeth Brodkin, the VP of Population Health and the CMHO, which really means the Chief Health Medical Officer. Brent Kershaw, VP of Informatics, Technology and Facilities. Naseem Narani, the VP of Communications and Public Affairs. And Norm Peters, the VP of Regional Care Integration. To those people, I say on behalf of all the people in this province, in this region, thank you very much. Because there isn't a day when those people aren't in that office and haven't been there for 14 months. So again, thank you for the work that you've done on behalf of the people of Fraser Health. So let's begin the meeting. The first question is from Carlene McKay from Surrey. It's on daycares. All Fraser Health licensed childcares must submit to annual inspections, which are posted on the Fraser Health website for parents to assess the safety standards of all childcares in this region. Why hasn't any data on childcare exposures or closures been posted on Fraser Health's website so that parents or childcares can assess the risks of their children attending childcare in this COVID-19 pandemic. When will we see this data? And I'm going to ask Dr. Brudkin to answer that.
Thanks very much, Jim, and thank you for the question. I think that what this question is getting at is the difference between the way that we manage exposures and report on exposures in schools and exposures in daycare. And since the very beginning of the school year, the school going back in September, we have been posting publicly any exposure that takes place in a school so that the entire school community can see it and take action on that information if they so choose. And the reason why we decided to post it publicly is that most schools exposures do not actually result in entire classes or the entire school being sent home. Typically, a small number of people who are most closely associated with the case are asked to go home and self-isolate, but the rest of the school community is allowed to continue attending. But parents, many parents expressed a desire to know about exposures that were taking place in their schools so that they could also make a personal decision about whether or not they wanted their child to continue attending, even if that child had not been asked to go home and self-isolate. So since the beginning of the school year, we have been posting all school exposures on our public website. It works a little differently in childcare because the nature of the exposures tend to be difficult. Child care facilities are, through their very nature, somewhat chaotic places, and it is difficult to separate out children who may have been exposed and children who have not been exposed when there has been somebody in the daycare with COVID illness. And so the most common scenario in a childcare facility or daycare is that everybody who has been in that cohort or that group or that room or that setting is actually asked to go home and self-isolate for the 14-day period. That the parents are generally not given a choice, and the daycare would be shut down until that exposure period was over. So because there is no decision for the parents to make in that scenario, we don't post the information publicly. It would be provided to the parents in the affected daycare at the time that they were all asked to go home and self-isolate, but there is no need for additional public notification.
Thank you. The next question is from Linda Angelica from Surrey, and it's on vaccines and pop-ups. How are pop-up clinics being announced? Why is there no official announcement made available on how it works and what people need to do? Language barriers work and not being taken, language barriers work and not being able to take the all day off are not accounted for when setting one up. For example, 18 plus in Newton Park. Do you plan on making a calendar as to when, where, and what time the immunizations will be there till? Because that would be great information for everyone to know. Also, by what other means do you plan to communicate all the information and the other info that people need to know? First of all, at this point in time, we don't have any pop-ups planned or drop-ins currently planned for the Fraser Health region. They're on hold for the moment until we realize how to approach the issues. Let me say why those pop-ups existed. Because we have 10 regions, 10 local health areas in Fraser Health that have some of the highest infection rates, have the highest infection rates in the province. And there are actually, I think, in the top 16 local health regions in our area. So our biggest challenge, frankly, is to get the people who are listening, but probably not, the people in the communities to go and get vaccinated. So that's why we did the pop-ups last week. There were some challenges doing it, but I personally believe that there will be a time perhaps when we'll do that again, because we do have to reach out and get people to sign up and be part of this. So we really are encouraging you to do that. So how do you do that? Well, you have to go onto the government webpage and you have to sign in. You can find out it on a webpage and find out the regions. And I just want to say this because I don't know if everybody knows. In these particular areas that I'm going to read out right now, you can sign up. And if you're 40 or over, not waiting for the 56 we're at now, I think, or whatever age we're at, if you're 40 and over, you can sign up and you will be given a time to come for a vaccine. And let me say that if you sign up today, there's a very good chance you'll be in this week in those areas if you're 40 years of age and older. But it's only specific to certain areas. And those are East Newton, North Delta, North Surrey, Panorama, South Langley Township, West Newton, Whalley, Fleetwood, Port Coquitlam, and West Abbotsford. So those are the ones that we have. And if you're in those areas, then you should sign up. I hope that's right, by the way, Elizabeth. Those are what I'm reading off my notes. Those are the right ones, right? Okay. Mm-hmm. So if you're in any of those regions, please sign up and come and register. And you will be getting a vaccine very quickly. And we encourage you to do that. The next question is from Beth Miller and Ravinder Darshi from Burnaby and Surrey. We put them together. I've received my first Pfizer shot. I have a CEV letter. When can I expect the second shot and how will I be notified? My father, 90 years old. Another question. My father, 90 years old. My husband, 75 years old, who has gone through chemotherapy for multiple myeloma, have had their first dose of Moderna. They need their second dose now. When can they get that? I'm 67 years old and their primary caregiver. Why can't I get mine at the same time? Elizabeth?
And thank you again for this question. I think what this question is, or these two questions are getting at, is the possibility of an accelerated schedule for the second dose of vaccine for people who are considered clinically extremely vulnerable. So a number of months ago, when it became obvious that there were a group of people who, because of their medical conditions, should be offered an accelerated first dose, Dr. Henry put together a task group of expert physicians to decide who belonged in that group. So which medical conditions did we want to target with an accelerated first dose, because those medical conditions put the people who have them at increased risk of significant complications from COVID infection. And the task group came up with quite a long list. It includes many cancers, it includes diabetes, and various other conditions that put the people with those conditions at risk for increased complications of COVID disease. And about 200,000 people in British Columbia received a letter saying that you are considered clinically extremely vulnerable, or CEV, and therefore you are eligible to book and receive your first dose of vaccine ahead of the age-based schedule. And most of those 200,000 people have now received their vaccine, I'm pleased to say. The question has come up, should that same group of people also receive their second dose ahead of schedule? So rather than waiting the 4 months that we're currently asking people to wait between dose 1 and dose 2, should they also receive an accelerated second dose at some shorter interval? The same group of expert physicians that looked at the possibility of accelerating the first dose are also looking at the possibility of accelerating the second dose. At the moment, their decision is no, the second doses will not be accelerated. And the reason why that is their current position is, first of all, the vaccine gives very good protection. One dose of vaccine gives very good protection, even to people who are considered clinically vulnerable. And a decision was made that given a relative shortage of vaccine, it is better to offer everyone one dose rather than a smaller group of people 2 doses and some people no protection at all. So at the moment, the provincial position is, if you're CEV, yes, you can get your first dose on an accelerated schedule, but the interval that you need to wait for the second dose will be the same as the rest of the population. Now, having said that, the good news is that we are rapidly receiving larger and larger amounts of vaccine. I think we're soon going to be swimming in vaccine. And I suspect that most people who are CEV will actually not have to wait that full 4 months, that we are very quickly going to be able to shorten that interval between the first and the second dose, not just for CEV people, but in fact for the entire population, because we're going to have enough vaccine that we're able to do that. But in the meantime, please be assured that even if you are CEV, you do have good protection from that first dose.
Thank you. The next question is, why are pregnant people not being offered a vaccine immediately? Most other provinces are offering vaccines to pregnant people because they are at risk of suffering from severe effects of COVID. Why is this delayed? And when are we going to push for vaccines to be offered to pregnant people? I think we have a positive answer to that one.
We have a very positive answer, although I will actually take a moment and explain why that announcement just came today. So today it was announced that anyone in the province of any pregnant woman in the province of British Columbia who is 16 years of age and older, that is 16 and not 18, is eligible to receive a first dose of vaccine. They can register and book immediately, and there'll be no further questions asked. They are eligible for that first dose of vaccine. The reason for that announcement just coming now and not a number of weeks ago was a lot of behind the scenes work was done to try to determine precisely what the risk of a pregnant woman, that woman's risk was of getting more severe COVID disease, ending up in hospital, and even ending up in intensive care. And some pregnant women, unfortunately, have ended up in intensive care. But the calculations were done to try to determine precisely what that risk was. And it was determined that the risk of somebody who is, say, in their 20s and pregnant of having a poor outcome from COVID is about the same as the risk of somebody who is in their 50s and not pregnant of having a bad outcome. So when the age-based strategy got down into the mid-50s, and those people shared a similar level of risk to those 20-year-old pregnant women, that was when the door was opened to all pregnant women along with the 50-year-olds. So that's why that announcement came today. But the announcement has come. If you are pregnant in the province of British Columbia, you can register and book for your vaccine today.
Great, thank you. This one is two questions, one from Amanda and one from Chrissy in Coquitlam and Burnaby. When can frontline workers in Burnaby expect to be vaccinated? And the second question is, why is there not a consistent program to vaccinate all Lower Mainland teachers when the entire area is a hotspot, especially with the ease of movement between and around health districts? The vaccinated people in Port Coquitlam, and I live right near the border of Poco and Coquitlam. And I'm a teacher living in Coquitlam, but working in Burnaby, which puts me at risk with even more people as I move about my home area and work area. Well, Preet, you're going to answer that.
Yes, thank you, Jim. So yes, to your question there, recognizing now as of this week in all of Fraser Health, we have invited all licensed childcare workers, school-based staff, police, RCMP, and fire department members that are in our region to receive their COVID-19 vaccine. Of course, those are not already. So we're taking and booking immunization appointments. I can say that to date, we've done 60% of this population. So once again, that's licensed childcare workers, school-based staff, police, RCMP, and fire department has already been vaccinated. And our goal is, as this population gets books for their appointments, that in the next 10 days, we'll be able to get the remaining 40% vaccinated.
Thank you. The next question is from Laurie Holmes from Coquitlam. What second injection is going to be given to all the people who are under 55 who received the AstraZeneca for their first shot? It's now been authorized for over 40, but people under 40, what will they be given when they say it's not safe for them?
So I think there are two questions here for people who've received AstraZeneca vaccine for their first dose. One question is, how long do they have to wait before they get their second dose? And the other question is, what vaccine are they actually going to be given? So to answer the first question, the interval between the first and second dose will be the same as it is for anybody else, regardless of which vaccine you receive for your first dose. At present, the interval between first and second dose is anything up to 4 months. But again, we expect that interval to be shortened quickly because of the amount of vaccine that is soon going to be arriving in the province. To get to the second question, what vaccine will they be offered for their second dose? Currently in BC, and this is unlikely to change again, currently in BC, we offer AstraZeneca vaccine to anyone who is age 30 and over. So if you are 30 and over and you received AstraZeneca for your first dose, you can receive AstraZeneca for your second dose as well. For those who are under 30, the final answer is not out yet, but there are a number of studies being done, particularly in the UK and Europe, to examine the possibility of mixing and matching vaccines. So what does it look like if you receive an mRNA vaccine, which is Pfizer or Moderna, for your first dose and something else for your second? Or to look at it the other way around, if you receive AstraZeneca or a viral vector vaccine for your first dose, can you receive one of the mRNA vaccines for your second dose? I'm confident that the answer is going to be yes, that there will be no issues about mixing and matching and having one vaccine for your first dose and one for your second dose, because they all, in the end, do the same thing, which is they get our bodies to develop antibodies against that spike protein. But we're just waiting for the final answer to come from those studies that are being conducted in Europe and the UK, and then we will use that information to make a decision about what happens in Canada and specifically what happens in British Columbia. But I am reasonably certain that for those of you who received AstraZeneca under the age of 30 for your first dose, you'll be offered an mRNA vaccine for your second dose.
Great, thank you. I've just been informed that Inderjeet, welcome Inderjeet to the meeting. Thank you for coming. Inderjeet's been a member of the board for at least the last 3 years, perhaps longer. The next question is from Andrea in Surrey. Its question is, why are masks not mandated in condos and apartments? I think it's incredibly counterproductive that masks are strongly encouraged, but not mandated, since condos and apartments share hallways, elevators, common spaces, which can increase the possibility of transmission. Lots of low-income families and POC. Why are you not protecting us by mandating this? We know that masks help in reducing the chance of transmission, so make them mandatory to protect people. Elizabeth, you've got a busy night tonight, I must say. Thank you.
Thank you very much for this question. And what this question is getting at is the difficulty of crafting not only appropriate, but effective public health orders. Writing a public health order is not a simple matter of saying, you know, I think X would be a good idea. I'm going to write an order and it's going to happen. It actually takes into account a lot of things, including what is going to be effective in terms of changing people's behavior and what is enforceable. Because not everything is actually enforceable or not enforceable without a very high cost. And it is much easier to write public health orders that apply to public spaces where it is easier to enforce those orders. And so it wasn't an accident that Dr. Henry's mask mandate was written about public spaces, public indoor spaces specifically. It is much harder to write orders and to enforce them in private spaces, private indoor spaces, and apartment buildings and condos are almost always privately owned, and therefore our ability to bring a mask mandate in and then beyond that to enforce it is much more constrained than it is in a public space. And I suspect that finally is the reason why there is no order in the private spaces, but there is in the public ones.
Regardless of the fact that there's no order, in many condos that I know, they've got the condo strata has made the order. So in my condo, this condo strata is, if you're anywhere in the building, in any public space, whether it's the elevator or the parking lot or the hallways, then you have to wear a mask. And so again, enforcing that may be difficult, but it is the culture. And in the last 10 months, I haven't seen a soul really in the building that's around people that doesn't have a mask on. So I think it is part of the culture too. So to the person that's putting the thing forward, the question forward, perhaps there's other ways to get to that point too. And certainly no one's saying don't do it. The next one is from Angel in Surrey. Why are we not doing a lockdown? Clearly there are some, if not many things getting out of hand. If not a lockdown, by what other means do you have of stopping people from breaking or not listening to the restrictions? Because the restrictions are clear from the beginning and are created to protect every single person, children, adults, and elderly. Thank you. Elizabeth?
Another excellent question, and it gets back to some of the things that we talked about in the previous question. What is an effective public health order? What is enforceable? And also this question touches on the issue of, you know, what is the balance between the good that you're going to do with an order and the harm that you might do with that same order? So throughout this pandemic, Dr. Henry has walked a very fine line of trying to craft orders which would be effective in terms of changing the behaviors that we needed to change in order to bend that curve, flatten that curve, bring those cases down, to write orders that were effective in accomplishing that, which were also enforceable, and to minimize the harm that is done by writing those orders. And many of the orders that she has written have in fact caused harm. And that includes, you know, the harm, for example, of closing schools during the periods when schools have been closed. That does cause harm to the children who are not able to attend school during that period. The harms of closing businesses and you know, affecting the livelihood of the people who own those businesses. And in some cases, unfortunately, actually putting them out of business. So it is a very fine balance, and you have to take into account the severity of the disease that you're trying to prevent and how much disease you have in your community. You know, what orders can you write that will help to mitigate that disease? Are those orders actually enforceable? And some things are very difficult to enforce. And how can you minimize the harm that you're doing with the orders you're writing? And all of that went into Dr. Henry's decision-making and the decision-making of the many, many people that she consulted before she actually wrote the orders, including her public health colleagues from across the province. So this is a good question, and there is no straight and easy answer, except perhaps to say that it's a balancing act, and the public health community found the best balance they could in crafting those orders.
Thank you. One last one. Why is Dr. Henry allowed to continue to enforce health restrictions on indoor dining, but is allowed indoor wine tastings? He owns a winery, and this is a direct conflict of interest. She should not be allowed to make these judgments. If all indoor dining has been restricted, then she should not be able to profit off her winery. All of her orders are clearly biased and made in the public's expense for her own enjoyment. Elizabeth, over to you.
Yeah, and thank you for this question, because I think there has been a lot of misunderstanding around Dr. Henry's winery, and I'm glad to have an opportunity to clear that up and address it. Dr. Henry does own a winery somewhere in the Okanagan. She's been very straight about that. She also recognizes that she has a conflict of interest and should not be involved in any decision-making around the closure or non-closures of wineries, and she recuses herself from every discussion that occurs about wineries specifically, and whether there need to be restrictions placed on them and whether they need to be closed or partially closed. She does not take part in those discussions, and she is not part of the decision making. Those decisions are made by other people, and she has done that specifically to address her conflict of interest.
Mm-hmm. The next one is from Zargam Ghazi from Surrey. Hi there. Could you please share the planned completion date of the new hospital in Surrey? I would appreciate if you could share any tentative milestone dates like design, completion, construction, and start of new operations. And I'm going to ask Nicole to answer that.
Thank you, Jim. Yes, we're all very excited about this new Surrey Memorial Hospital. We have presented a budget in 2021, and the schedule predicated on this particular budget has a construction plan to start in the summer of 2023. And the new facility is expected to open for patients in the summer of 2027. I could also add to this that the new hospital would include 168 patient beds, the department, medical imaging department, including CT and MRI, surgical suite, pharmacy, laboratory, and academic space. The new cancer center will also include an oncology ambulatory care unit, chemotherapy, radiation therapy, functional imaging, and a new cyclotron. So it'll be a very interesting project to go through. Thank you.
Thank you. Yes, this is exciting. It's in the midst of the pandemic, we're still planning a new hospital. And it's nice that we can see over the hill of this pandemic and see that down the road, things like the new hospital, a number of other things we're working on are still proceeding. The next question is patients from Deborah, a patient experience. I was very excited to see that Fraser Health was implementing a patient portal where we can get access to our medical records. Fraser Health was leading the way in the province, providing patients the necessary tools to take charge of their health. However, I've heard through the grapevine that you are no longer going forward with the patient portal. Is this true, and why was this decision made? It seems like a major step backwards in an area where access to your own health information is so key. I'm going to ask Brent to take that question. Oh, there you are right there. Thank you, Brent.
Yeah, sure thing. And thank you for that question.
That's the hot seat we call that you're in now, you know?
Yeah, definitely. Yeah, so it's true. Fraser Health has been piloting and demonstrating a personal health record tool for the last 2 years. And, you know, as part of that initiative, we've been collecting the learnings and trying to better understand what makes an effective personal health tool or patient portal. A couple of the key learnings we found, one is that registration needs to be self-service and it needs to be online. And that wasn't a feature set that the tool came with. The second thing was that while Fraser Health does have good data. We have great data. We don't have all of an individual's health data. There's information within your primary care chart at your family physician's office. There's information in the specialist's EMR, and there's information in provincial registries. And really, one of the things we learned here is we would really benefit from a solution that started to bring more of that data together. So while we haven't turned the solution off at this time, we are looking at what would be involved in decommissioning the solution. But concurrently with that, we're looking at, okay, what is the next step for Fraser Health? So I completely agree with your comment that to just turn this off now would be a step backwards. And so we're working with our health authority counterparts as well as the Ministry of Health to say, okay, what does it look like moving forward with, an engaged population that wants access to their own medical records, and how do we give them that seamlessly and the most comprehensive information? So that's where we stand at this time. Thanks again for your question.
Very much. The next question is the question from Roy Basile from Surrey, and it's I'd like a better referral system, just some kind of confirmation that it's been received by the referral doctor's office. My daughter has had 2 referrals not received from two different endometriosis doctors over the years, and we don't find out till months later. This needs a change. And didn't introduce Ralph at the beginning of this, but Dr. Ralph Bell, welcome. And Ralph decided to become our VP of Medicine in the middle of the pandemic. So, thank you very much. Over to you.
Thanks, Jim. Good evening, everybody. Appreciate the question and appreciate the frustration that goes about the referral consultation process. What we would like to see is that the communication between family physicians and specialists is seamless, and that at the end, the patient and family experience is a good one. Now, this doesn't happen all the time. We know this. I know this as a specialist myself. Why does that happen? It can be multifactorial, and I think some of the onus is on the physician's offices, whether it's the GP's office or the specialist's office. Some of the problems we have are in terms of integration of our IT systems. Electronic medical systems came on board probably in a fulsome fashion about 12 years ago. There's many different systems out there. Many physicians haven't even signed on to EMR. It seems a little bit odd in 2021 for that to be the case, but that is still the case. There's still fax referrals coming in. And how do referrals get lost? That's the question. And they're kind of out there in the ether somewhere. We need to have a better solution in the future. I think there will be a better solution in the future. It'll be solved by IT. And what we would like to see, and this is again for the patient's journey, when a referral is made, like the GP makes the referral, the specialist gets the referral, but the patient is also notified that there has been a referral, and they actually know where they are along the process. And we can do this for everything, including even lab results. And we're talking about this for surgical wait list systems and so forth. But in the interim, what I would say, patients and families should advocate for themselves. So if you know a GP, your GP has sent in a referral, or maybe it could be a walk-in clinic. Follow up with that. Make sure the referral has been done. If you know the name of the specialist, call the specialist's office and find out where the referral has gone. And the health authority, most physicians' offices, both primary care and specialists, they're private offices. They're outside the purview or accountability of the health authority. But if the health authority can help with the partnerships between the specialists and the GPs in the future, and how referrals eventually come in, I think that would be quite impressive in the future. But I think overall, as I said, IT is going to be the ultimate solution for this. Again, appreciate the frustration associated with those referrals.
Yes, thank you. Progress will be made. Sarah from Chilliwack, mental health and substance abuse. I would like to know when another bid opportunity for a safe consumption site in Chilliwack will happen. Also, if there's an opportunity to open a clinic that allows users to interject Now, I'll try this one. Diacetylmorphine, basically diacetylmorphine, like the Crosstown Clinic in Vancouver. They conducted a study, Salome, and its results were beneficial. Something like that out here may help the crisis that we're in. Norm, thank you for coming, and over to you, Norm Peters.
Good evening, sir, and thank you very much for that question. So regarding the first part of your question, we do not have any plans at this time to conduct another request for proposal for overdose prevention services in Chilliwack. We are, however, currently working with the First Nations Health Authority and a local First Nations in Chilliwack and exploring the possibility of an overdose prevention site located on First Nations land that would be accessible to all people in the community. Regarding the pharmaceutical alternatives, that is being discussed provincially as a possible alternative and approach to helping people safely get away from the very highly toxic drug supply. The Ministry of Mental Health and Addictions, the BC Centre for Substance Use, and the various regional health authorities are engaged in discussions around how we can implement a pharmaceutical alternative, including diacetylmorphine, and how we can use that to ameliorate the effects of this very toxic drug supply. And as we get more information available and are looking at service models, we will then start a broader consultation process.
Okay. Don't go away. Thank you. Alicia Ram from Surrey. How has the FHA supported community-driven efforts that have been developed and delivered by racialized communities that are disproportionately impacted by the overdose crisis? More specifically, initiatives that have been informed by lengthy consultation involving multiple stakeholders. How does the board of directors plan to support innovative and culturally nuanced approaches such as SALMNON project and the Overdose Intervention app? And what are the anticipated outcomes of this work? Norman?
Okay, thank you, Alicia, for this very important question. As I'm sure many of you are aware, we've now just passed the 5-year mark on the second public health crisis that is ongoing in the province of BC, and that is responding to the overdose crisis. There has been factors that have contributed to an increase, which is very unfortunate, partly due to the very toxic drug supply that's now in the province. And there are a number of initiatives that we're undertaking. So I'm going to talk a little bit about some of the questions that you had in here. In the Overdose Intervention app, I'm going to assume you're referring to the Lifeguard app. We promote this app quite extensively and encourage everyone to download it and have it available to them. And one of the things we noted was that we needed to ensure it was available and accessible to more communities and those that where English is not their first language. So we've just recently provided a new update of the app where it's been translated into Punjabi as one of the optional languages. We are going to be doing additional translations of this app. We haven't yet decided which will be the next language, but we are going to be looking at some of the data in terms of overdoses to help inform us in terms of what language should be the next one that we would prioritize. Certainly, we continue to have a strong emphasis on prevention work and increasing the number of overdose prevention services that we have available. Recently opened one in New West. We've also invested in some drug checking technology so that people can see if there's they have a toxic drug supply. And we continue to work with many community partners, including First Nations, to help meet the needs of those communities, especially those that are most vulnerable. Our anticipated outcomes, our first focus is on harm reduction, and that is saving lives due to the overdose crisis. But at the same time, we continue to invest in increasing our substance use services, which will help provide more access to services, including a full continuum, moving more upstream around the prevention and education, treatment, support, and aftercare to help keep people from seeking drugs, toxic supply in the first place. So that work is ongoing and quite important in addition to the other public health crises that we continue to manage. And Jim, I think there was a question
Yes.
previously.
Yes, a family member with mild dementia was recently arrested, detained under the MHA, the Ministry of Health. From that point, he was restrained and medicated without consent. We've since learned that there is a growing use of the MHA against seniors, impacting their dignity, autonomy, quality of care in medical areas, etc. Fraser Health has a philosophy of patient and family-centered care, but the use of the MHA contradicts it. Will the FHA board review the use of the MHA against our seniors and actively promote the PT, the patient family voice in care? An important question. Over to you, Norm.
Yeah, thank you for the question, Rose, because it is quite important, this conversation around the appropriate use of the Mental Health Act and when it is appropriate. I'm not aware of any increased use of the Mental Health Act, either in the data that we collect or any anecdotal information that would suggest that there's an increased use. However, it doesn't mean it's not an important question and something that we need to pay attention to. And I can completely understand and appreciate that this is very distressing for individuals when they're in a place where they're becoming unsafe and not able to direct their own care. And we do have to make some serious and difficult decisions around how to best provide that care. And at times it has involved the use of the Mental Health Act to ensure people get access to care. What we focus on is ensuring that those experiences are very brief, that there's a focus on stabilizing the individual, and that is a tool that's used as a tool of last resort and not one that we immediately go to. We are very committed to ensuring we follow all the legislative requirements and that we're providing quality care for anyone that is underneath the Mental Health Act, which involves and includes ensuring that they know their legal rights, that we help them if they want to make an appeal to the Mental Health Review Board, and that families need to be included as part of these conversations. We do have options available for family members. We can help support them through the Fraser Health Mental Health and Substance Use Family Support Services. We do have a regional consumer mental health and substance advisory committee, as well as local consumer family advisory committees in all of our communities that have made up of individuals that have had lived experiences and family members that have also had that experience. And we do welcome anyone with those experiences to be part of those committees, as well as seeing how those committees can help support you during a very difficult period.
Thank you very much for the question, and thank you for the answer. And the last three questions are about the Delta Hospice Society, and they're from Sandor Giamatti from the Delta Optimist. Any comment on the Delta Hospice? What kind of upgrades are done to the facility, and is FHA currently running the counseling services out of the Supportive Care Center? Before I answer that question, just let me say on behalf of the board, and we started to deal with this about 16 months ago. And at some point, the board made the decision that the hospices that we fund should provide all of the services that are legally available to the people who are at hospice. And in this case, we were discussing the services of MAID, which are obviously controversial at times, but the board made a unanimous decision that it wasn't our job to judge that. It was our job to make sure that where we're funding the services, that people can access those services of their free choice. And it came to the point with the Hospice Society that was running it that they declined to offer those services. We served 1 month year notice that we were withdrawing the contract and the money without costs. That was in the contract. So for a year, we had to wait. At the end of that year, there was a 30-day period where the hospice closed. And I'm happy to say that it's now reopened. The employees have returned and the staff are there, and the services, all the services are being offered again to the people of Delta. And before I answer the question, I also want to say thank you. I felt as a board chair and the board, we felt supported in our decision by the community of Delta. The local MLAs were excellent. The local city council and the mayor, Harvey, were all supportive of returning the hospice from the society to the community and to the Fraser Health Authority. And so again, I want to also thank the people who work there. I know from a number of them who have phoned me and offered support for what we're doing, but also how difficult it is to work in a caring situation and just to have the uncertainty and the controversy around that. So I want to say that as a board, we've learned from that, and we've now reviewed our legal policies on contracted services and are looking at making changes so we don't get in this situation again. So again, to the people of Delta, we're glad that we're open again. We're glad that it's turned out, and thank you for your support. On the detail of that question, on the first part, we have made some minor changes. The hospice now has, we're changing a number of the rugs that need to be changed. We're changing, putting in more wipeable surfaces to avoid spread of disease and different furniture. So there are some changes, but the building is sound, and it is one of the most beautiful hospices that we have in the region. So it doesn't need a lot of work. And many of the employees have returned back to those areas. As for the counseling services, I'll let Victoria answer the question of how we're providing the counseling services going forward now.
Thank you so much, Jim. In terms of the counseling services, there are formal clinical counseling services that are offered through our hospice services, and then there's also counseling, peer support, and family supports that have been provided throughout. So what we're looking at is working with our community members and engaging with our community, including the municipality, to see what kind of services would best serve the community in that building, because there's the main hospice building as well as additional building in that premise, and we'll be engaging in public community engagement consultation to decipher what types of services are required and would be most beneficial, and then looking at who can provide those services as well. We're not limiting to senior services only, as we know that sometimes multi-generational type of approach and having different types of groups in the same area can be healing and quite beneficial for groups. So looking at multiple options in that area, which includes counseling as one of the components.
Thank you. The next question is, any discussion with the new Heron Hospice Society about partnering with the FHA? Obviously, as Victoria has pointed out, we are in discussions, and they're one of the people we're going to discuss it with. There are a number of people, including former people from the former Hospice Society, that are part of this group, and they're a big part of the community. So obviously, we will be in discussions with them and the rest of the community about how to provide those services. And any discussion with the City of Delta, which came forward asking to take the lease of the supportive care center, how would the city be involved? Again, we are reaching out in the near term with the city to have these conversations. We have appreciated their support in the beginning on this, and we hope no matter how we answer that question, we'll continue to work with them to make sure those services are there for the people of Delta. So again, thank you to City Council, and we look forward to working with them. And that is the last question we have for this evening. I want to thank again the staff and the people who are here tonight, the executive, and the people of the region. There is two or three things I think worth mentioning that haven't come up tonight. And we have a few minutes. One of the issues that we've dealt with as a board this year in a major way, despite the pandemic, is the issue of racism in the healthcare system. And we've seen this year that this issue has had more profile than it's probably had in 10 years. And Mary Ellen's Trufant's report, which was in a sense, a visionary document and an indictment of the system. The report said what we've all known all along, that there's systemic racism in the system, and that unless we deal with racism in the system, then it won't be a healthcare system for everybody. And it's not just the people who are suffering the oppression of racism that pay the price. We all pay the price when there's racism. We are all dehumanized, and we're all put in a situation that is unhealthy for everybody involved. And so we have, as a board, formed a much stronger unity with the people in the communities, the First Nations communities and the urban areas. And we have now an action plan in place. We're seeking the funds to put it in place so that we can guarantee over the next period of time that we can work to root out racism in the system. And so I really want to say to our partners in the community, in the Indigenous community, thank you. Thank you for having the faith that we can change this system and having the faith that working with us as partners is going to pay off. And I just want to say that to the people of this region, we know it's not just Indigenous people who suffer racism. that we understand that racism is a fact of life for many groups in this community. And so as we work on the Indigenous issue, we continue to work on all forms of racism. So again, thank you to our partners and to the staff who have made a big part of this job, and to the board members who have been part of this. And the other comment I'd like to make is around surgeries. As I said, we've shut down elective surgeries. This is difficult, a time to do this, because they may be called elective because they're not urgent, but they're very important. And sometimes they're life-saving surgeries. And so we don't know when those will be opened again. But since reopening surgery, our health authority has led the province in terms of coming back up to where we were and actually increasing the number of surgeries that we're doing at a time that there was a pandemic. And the vision of this government is to move the surgeries up about 30% more and start operating in the evenings and on the weekends. We recognize that surgery is critical for people's well-being, not only their health, but their ability to function, be mobile, and be part of the community. And so I'm looking forward to, in the next period of time, as one of our goals is to deal with the surgeries, the backlogs, the wait lists, and make sure that our modern hospital system, over the next 2 or 3 years, will actually be able to meet the needs in a more fuller way. So again, to the people who work in that section, thank you. And to the people in the communities, thank you for your patience. It is a difficult time. I'm just going to turn it over to Victoria to say a few words, and then we'll wrap it up and say goodnight.
Thank you so much. Thank you so much, Jim, for hosting and coordinating, as well as all the board members for your contributions and advice and leadership throughout the pandemic. I'd like to acknowledge that we have 40,000 people that we call Fraser Health Family that work or volunteer in our region. And throughout the pandemic, it's been tough and challenging, and especially right now with the third wave, it's been the most challenging time. Our teams have made extraordinary efforts, have been making sacrifices on a day-to-day, hourly basis, and they're working every day to ensure that we're providing the highest level of care possible. So I'd like to acknowledge and thank everyone that's working in Fraser Health, whether you're working the front lines or behind the scenes, as well as acknowledge all of the people that are participating tonight and all of our communities, businesses, our schools, and our lovely partners throughout the pandemic. It wouldn't have been possible to respond to this pandemic without our collective efforts, and we need to continue to do so. And one of the biggest urgency and pleas that I have is to please register, book your immunization, and get your shot as soon as you're eligible. We need to ensure that everybody does that to get the pandemic behind us. So thank you again, and I will say goodnight and pass it back to Jim.
Thank you, Victoria. And again, thank you for all of your work as well. You've given incredible leadership. I just want to say that, it's up to us if this is the last wave or the third wave. And really, I think all of us are ready for the last wave, not the third wave. And I know that when we saw that third wave coming about a month and a half ago, I think we all kind of felt a sick feeling in our stomach. We're going to have to do it again. And I'm tired of that feeling. And I know we have within our grasp the ability to make it the final one, not the third one. And so to reiterate what the Premier has been saying, what everybody's been saying, we have spots this week in Fraser Health. If you haven't registered, please register. Because unless you take advantage of that and get the vaccines, then we won't get the job done. And I'm happy to say that in the age of 70 and 80, we've got upwards of 80% of people vaccinated. That's what we need in the 60 to 70-year-olds, and the 50 to 60-year-olds, and the 40 to 50s, and the 30s to 40s. We need 70 to 80% of people vaccinated. That's what they call herd mentality. At that point, life becomes as close to normal as we'll get. So if there's one message tonight, don't wait, don't hesitate, sign up. We're waiting for you. And we know that this pandemic, by our collective action, and whether that's staying home, whether that's staying 6 feet apart, whether that's wearing a mask, whether it's respecting your coworkers, or whether or not it's getting a vaccine, it's going to take all of us to solve this. And so again, my appeal on behalf of the board is to do that. And I too want to thank the board members for the work they've done over the last year and all of the contributions that you've made. It's been a tough year for everybody. And I would ask if any of the board members would like to step in and say anything, you're welcome to. And otherwise, we'll say goodnight. But if anybody would like to say final remarks and reflections, more than welcome to. And thank you for being here tonight. And you're all going to be shy, aren't you? Yes, I know. All right. Anyway, to the people who have tuned in, thank you for your time and your effort. And we hope we can make this a more regular event. Thank you very much. Good night.